There are three different dental plan types that you can choose from to go along with Original Medicare. Original Medicare does not cover your typical dental work. It covers emergency medical procedures related to dental, but it does not cover cleanings and cavities and crowns and things like that. So most people coming into Medicare generally had a group health plan at work, and they generally had a group dental plan at work as well. So you likely are going to want to have dental coverage while you're in Medicare, because obviously dental things are quite expensive at times, and we want to be comfortable and certainly not have any drawbacks from going to the dentist. So I'm going to go over the three different types of plans. It's not too complicated, but you need to understand exactly kind of how they work different from each other. So the three types of plans, the first one is called a discount dental plan. The second one is an indemnity dental plan. And the third one is a PPO dental plan. If you had a dental plan at work, you likely had a PPO dental plan where you had a network of dentists that you choose from to have the best possible payment from your dental plan. And it also had an out-of-network benefit if you wanted to go to a dentist that was not in the network. So I'm going to go through the different types and explain really what advantages there are to some versus others. The first one we'll talk about is dental plan. From a cost standpoint is the discount plan, and the discount plan is exactly that. It runs generally between $10 and $15 a month, so it's a very low premium plan, and the way it works is with a dentist in a network, so we'll have a network of dentists, but the plan doesn't actually pay the dentist, and it doesn't actually pay you. It doesn't actually pay anybody. What it does is it pre-negotiates rates with a network of dentists. So your costs going in, you'll know ahead of time, and it's typically 40 to 60% less than what it would be without insurance. So something right off the bat that you want to have, because it will lower your out-of-pocket costs when you go to the dentist. So whether it's for a cleaning or whether it's for a crown, it's going to be significantly less than what you would have without insurance. And the benefit of it is they've already negotiated, so you don't have to negotiate with the dentist. Last thing we want to do is be sitting in a dental chair and have to really figure out on, can we afford it? Is that what it's really going to cost? Is there anything you can do for me? So a discount dental plan does just that. It pre-negotiates the rates ahead of time. And I'm going to show you in a minute. It's pretty much a do-it-yourself kind of thing. I'll show you. I have a website to go to where it has a multitude of different discount dental plans, and I'll show you exactly how to do it. It's very easy to do, and again, it runs typically between $10 and $15 a month. Another thing to understand with most of these dental plans is they're not just dental. They're dental, vision, and hearing. And a lot of people may not need vision, may not need hearing. On the discount plan, you can separate the dental part where it's just a standalone dental plan, or it can include vision and hearing. So that's the first choice on dental plans, and we do quite a bit. I mean, that's again, it's a very affordable option, and it gives you kind of ahead of time knowing exactly what the cost will be. The drawback to it would be likely the network of dentists. So a dentist that is well established and has a big practice, maybe in your area, maybe someone you go to now, may very well not be part of a discount dental plan because they don't need to be. So it's usually for dentists that are building their practice that may be a bit newer, but still may not be bad. If you find one you're comfortable with, then that's really all that matters. And if you can discount your price, by half, then that's a fantastic thing as well. So the second option is an indemnity plan. So an indemnity plan is one that pays you instead of the dentist. So you go to the dentist, you have your work done, you get a receipt, you fill out a claim form, you submit it, and they send you a check. So they don't send the dentist a check. So this works terrific, and this is really by far the number one plan that we sell, and I have lots of people with it. I have very few, if any, complaints Matter of fact, I can't even recall a complaint. So people are pretty happy with it, where they're in control. They can go to the dentist of their choice. They don't have to choose from a network, and it will reimburse them on the procedures that they have. Now, things to understand with dental plans is you can see the benefit outline here for this plan. You can generally choose between $1,000 maximum annual coverage, $1,500 or $3,000. And plans in the indemnity space run typically between $40 and $60 a month. So they're more expensive, but you have a higher level of benefit, and they're going to reimburse you for procedures that are done at the dentist's office. Now, another nice benefit of this plan, it also has a network. So it has a network called the Covington Network, where you can choose to find a dentist in the network, and when you do that, the rates are pre-negotiated already with that dentist, so it will likely be a lower cost from the start, and then you also get reimbursed from your out-of-pocket expense. Now, something to understand with dental plans, like this indemnity plan and the PPO plan I'll talk about in just a second, is they almost always have a 1-year waiting period. So you can't just jump into a dental plan and have major work done. There's generally a 1-year waiting period where it does have coverage for basic services, checkups, cleanings, cavities, things like that, but it won't have coverage for major services like crowns or bridges or things like that. So you can see right here the level between year 1 and year 2. So you kind of want to get your clock ticking sooner than later, just so you can get to where your benefit level would be. And again, it's designed so you can't wait until you have a major problem and then sign up for dental insurance. So you need to sign up really at a time where you're just coming into Medicare, coming off of another dental plan. Things are kind of typical and normal going forward. So that's the indemnity plan. Again, a great option, sends you a check instead of sending the dentist a check. And then the third option is the PPO option. So the indemnity plan that we have is not offered in every state. It's in the majority of states, but it's not in every state. So the states that it's not in, we have a PPO option where it is a network of dentists, pretty large network of dentists, and generally well-established dentists are in the network, or it has an out-of-network benefit as well. But it works very similar to the indemnity plan, with the exception of it sends the dentist a check. So it reimburses the dentist, so you won't necessarily have that out-of-pocket expense in the office because the insurance carrier is going to send the check to the dentist. So it works the same similar fashion on benefits, where there's a year waiting period. It covers basic services in the first year, major services in the second year, and it provides a good reimbursement to the dentist. So it works out very well. It's very similar to what you probably had at work previously. So hopefully your dentist would be in the network, and we can certainly look that up very quickly and easily for you, and just make sure that it's exactly the one that you want. So those are the three options: the discount plan, the indemnity plan, and the PPO plan. I'm going to show you right now, if you want the discount plan, how to do it. It's very easy. And if you want to get back to this video, it's also pretty easy to do. You just go to dentalvideo.info, and it'll bring you right back to this video. And then to go to the site for the discount dental plan, it's located at seniordental.info. So you just go to seniordental.info. I'll put the links below the video. And again, so do it yourself. I'll show you how to do it right now. So let's take a look. So this is the site for discount dental. It's called dentalplans.com. You can see, you want to make sure you're in the right place, because I do have some preferred pricing. So make sure you see my information down here. And if you happen to call them, just tell them that you have this broker code right here, and that will keep you connected, so there's no losing any discounts or anything like that. But this is pretty easy to work through. I'll show you exactly how to do it. You can see sometimes they have sales and things like that, but you simply put in your zip code, click find a plan. And again, here you might want to look through dentists. What you'll typically find on discount dental plans is not necessarily the more established dentists in your area that just don't need to have discount plan type programs, where they they practice. So this, you may not find your dentist there, so you'll need to make that choice on your comfort level, but usually there's a pretty good selection of dentists. So when you come in, just put in your zip code and you'll find a multitude of different plans. So these are all different plans: Aetna, Vital Dental Savings, Solstice, Cigna Plus Savings, 500 Series, iDental, Cigna. What I generally look for in this type of plan is name brand, one that I'm going to be comfortable with. And you can see some have plus to them where it includes things like vision. So it's important to understand that if you don't need vision, you don't really need a plus plan. Some will include hearing benefits, so you don't need that if you don't have it going forward. But you'll see right down at the bottom, $10.83 a month up to $12. So this one includes vision and hearing. That's why it's a little bit more on price. If we go down and find one that's not in the plus, it's only $10 a month. So that's just dental. So I would be choosing really between Cigna, Aetna Dental Access. Again, if you need vision, hearing, this one also has prescription, so it's a little bit more, $12 a month, but it's not a lot more. So it's just a question of what you feel comfortable with. But I would stick with a name brand. I would likely not choose Patriot or Dentagra, just stuff you haven't heard of before. Humana's good, Cigna's good, Aetna's good. So if you look into the benefits, you just click on View This Plan, and it shows you exactly what parts are covered, and then it'll give you a breakdown, specifically on what things cost. So when you look at, a routine 6-month checkout without the plan would typically be $49. With the plan is $27. So it's that type of discount. Single crown, typically $1,200. So $735 on this plan. You can look through different plans and see the different type of cost differences and the discount that's involved, but it's significant. You don't want to be paying $1,200 for a crown. You don't really want to pay $700 for a crown, but it's certainly worth getting the $500 discount for what amounts to $10.83 a month. And you can see there's almost 1,100 dentists near me in this zip code. You can go benefit by benefit. It'll show you exactly what they are. And then you can find the dentist. Let's see if we can figure it out. Participating dentist. So you put in your information. You can search by location, what's close to you. And again, pretty easy to compare and work with. And then whichever one you find you want, you just click on Join This Plan, and it'll bring you to the page where you just put in your basic information and makes it easy to do. So you can see here, there's a coupon right now for $30 off this plan. So it'd be $150 for the entire year for the discount plan. So it's a great benefit to have if you do not have traditional dental insurance like the Indemnity product or the PPO plan that I talked about earlier in the video. So this is absolutely something that I recommend at the very least to have for dental coverage, so that way you do have a discount when the time arises. So I hope you found this helpful, and I think you would do very well with a discount plan like we just went over here. So that gives you your options for dental coverage, either a discount plan, an indemnity plan, or a straight up PPO plan. And they're all good options. It just depends on your level of comfort and maybe how much dental work you've had previously, and kind of a forecast of how much you might need in the future as to which way you'd want to go. So we'd be happy to help with that. Just give us a call, or you can fill out the form on my website, and we will go over the options with you and show you exactly what the cost is and how they work, and we'll put everything in the right place. Hope you found this helpful. Have a fantastic day. Wait, don't go anywhere. There's a couple more videos right here that you'll find very helpful with your Medicare journey. So take just a minute, watch the videos. You can also subscribe to my channel by clicking this button, and that way you'll have access to all my videos for everything that you need for Medicare. Hope you find it helpful. Have a fantastic day.